When Harold came back for his follow-up, I noticed something different about him. He stood taller. His tone was relaxed, even proud. "You were right, Doc," he said with a grin. "It wasn't about quitting, it was about balance." That change in his voice said more than any medical test could, because when a man understands his body, he regains control over his life. You see, the prostate isn't a fragile little gland waiting to fail. It's actually quite resilient. But like any organ, it responds to how we treat it. Think of it as a quiet worker in your body, doing its job behind the scenes, producing fluid that nourishes and transports sperm and supporting healthy urinary flow. When we overwork it or neglect it, that worker starts to complain. Over my 30 years in men's health, I found something fascinating. Men who maintain a gentle, regular sexual rhythm, especially into their 70s, often report fewer prostate symptoms than those who stop completely. Why? Because the gland stays flushed. Stagnant fluids can build up when ejaculation is infrequent, and that can contribute to swelling, discomfort, or even infections. But on the other hand, when a man overstimulates daily without enough rest or hydration, the tissue can get irritated, leading to that dull ache Harold described. It's a fine line, and that's why listening to your body is the golden rule. Now, I want to pause for a second, because this is where I often see men nodding along quietly, but not saying a word. So let me ask you directly. If you've ever felt unsure about what's too much or too little, just type yes in the comments below. You'd be amazed how many other men are wondering the same thing. And if you're watching this and learning something new, give the video a thumbs up. It helps more men your age find answers they can trust. Back to Harold. After a few months of adjusting his habits, he noticed something else. His nighttime bathroom trips dropped from 4 to just 1. He said, "I didn't expect that." But I wasn't surprised. You see, the prostate surrounds the urethra, the tube that carries urine. When it's inflamed or congested, it squeezes on that tube, making you feel like you need to go all the time. By keeping his prostate healthy and reducing irritation, Harold's bladder could finally relax again. There's another part of this story most men don't realize: the mental connection. When men feel anxious or guilty about sexual activity, that stress doesn't just live in the mind. It affects hormones like cortisol, which can tighten muscles in the pelvic area and increase inflammation. In other words, worry itself can worsen prostate symptoms. That's why understanding what's normal is so freeing. Let's be honest, our generation wasn't raised to talk openly about these things. Many men in their 60s, 70s, and beyond were taught that self-pleasure was something shameful or harmful, but science paints a very different picture. Studies suggest that regular, balanced sexual activity, even solo, can lower the risk of prostate congestion and promote better circulation. The key word, though, is balance. You know, I had a patient once. Let's call him Harold. He's 76, retired, a cheerful man who still rides his bicycle every morning. When he first walked into my office, he looked embarrassed. He said, "Doctor, this is awkward, but I've always had a strong drive. I still enjoy myself, even at my age. But lately, I've been hearing that too much of it could hurt my prostate. Am I doing something wrong?" Now, Harold's question isn't rare. In fact, men over 60 ask me this more than you might imagine. And it's a good question, an important one. What actually happens to the prostate when a man masturbates regularly? Does it shrink, swell, or wear out with time? Or could it, surprisingly, stay healthier than we think? I'm Dr. Nolan Easton, and after more than 30 years working with men's health, I've seen firsthand how habits, both physical and emotional, shape the aging body, especially the prostate. This small gland, about the size of a walnut, plays a much bigger role than most men realize. It's not just about ejaculation or fertility. It's about comfort, urinary flow, and, believe it or not, emotional well-being too. When Harold asked me that question, I could see the fear behind his humor. He wasn't just worried about his prostate, he was afraid he might be harming himself, or worse, that he was too old to be doing something natural. And that fear of aging, of being judged, of losing control of one's body is something nearly every man over 60 feels at some point. So let's get real about it. Masturbation in itself doesn't destroy the prostate. In fact, moderate and consistent ejaculation, whether from sexual activity or masturbation, can actually help the prostate by flushing out old fluids and keeping the gland active. Think of it like exercise. When you move your muscles, they stay strong and flexible. When you don't, they stiffen. The prostate works similarly. Now, that doesn't mean daily stimulation is perfect for everyone. There's a balance, especially after 60, when hormone levels shift and the prostate becomes more sensitive. For some men, excessive activity can lead to soreness or mild inflammation. For others, it might relieve tension and help with urinary flow. It's not one size fits all. The body has its own rhythm, and listening to it is key. Harold told me he'd been active almost every day since his 50s. He said, "It's my stress relief, but sometimes I feel this dull ache afterwards." That gave me an important clue. His body wasn't saying stop completely, but rather slow down. Just like with exercise, recovery matters, especially at his age. We talked about how blood circulation to the pelvic area changes after 60, how the prostate tissue can grow slightly, a condition called benign enlargement, and how regular but gentle stimulation can actually help keep fluids moving through the ducts, preventing blockages. But it's when men push themselves too often, ignoring fatigue or discomfort, that problems start creeping in. The truth is, many men in their 70s and 80s still enjoy an active sexual life, and that's perfectly healthy. What matters most is awareness, knowing your body's signals and not letting fear or misinformation dictate your choices. You see, there's a myth out there that after a certain age, men should give it up, that somehow sexual expression becomes shameful or harmful. That's simply not true. I always tell my patients, the body doesn't have an expiration date for pleasure, it just needs balance. When used wisely, daily stimulation can support prostate circulation, reduce congestion, and even lower stress hormones that affect sleep and mood. But when it becomes mechanical, rushed, or obsessive, it can backfire, causing irritation, fatigue, or even a loss of sensitivity. That's what I explained to Harold. Your prostate isn't your enemy, it's your partner. Treat it with care, and it will serve you well. We adjusted his routine, added rest days, encouraged hydration, and focused on slow, relaxed sessions rather than quick release. Within a few weeks, his discomfort faded and his confidence returned. Before we go further, I'd love to hear from you. If this topic resonates, or if you've ever wondered about your own prostate health, go ahead and click the like button. It helps this message reach more men who need to hear it. And leave a simple yes or no in the comments below. I read your responses personally, and they help me tailor future videos to what matters most to you. One of the simplest changes I recommend to my patients is mindfulness. Instead of rushing, they slow down. They take time to breathe, to notice their body's signals, to stop if there's discomfort. And yes, I even teach pelvic relaxation exercises, because the prostate doesn't exist in isolation. The muscles around it matter too. When Harold practiced this, he said something that stuck with me. I stopped chasing release. I started enjoying the process. That's when the ache disappeared entirely. It's amazing how shifting from performance to awareness can heal more than just the body. It heals confidence. For many men, the fear of prostate trouble can feel like a dark cloud. You might notice weaker flow, dribbling, or that annoying urge to go at night and wonder, is it because I'm still active? But most of the time, it's just the natural aging of the gland combined with changes in hormone balance. Testosterone dips slightly, and estrogen becomes a bit more dominant, causing prostate tissue to grow. Add stress and poor hydration, and it's a perfect recipe for discomfort.
Harold's story didn't end there. Once his discomfort subsided and his confidence returned, he wanted to know why the changes worked. He leaned forward in my office and said, "Dr. Easton, how come slowing down made everything better? What's actually going on in there?" That's the kind of curiosity I love, because when a man understands his own body, he takes better care of it. So I explained to Harold what I'll share with you now. The prostate is a dynamic gland. It's full of fluid, muscle fibers, and small ducts. These ducts empty into the urethra during ejaculation. When you go long stretches without releasing, those ducts can hold older fluids which thicken and stagnate. Over time, that buildup can lead to pressure, discomfort, or even mild inflammation. On the flip side, if a man ejaculates too frequently, especially without proper hydration or rest, that same tissue can get irritated, just like a muscle used without recovery. In other words, it's not about abstaining or indulging, it's about rhythm. When Harold began balancing his habits, allowing a day or two between sessions, staying hydrated, breathing deeply, and keeping relaxed, his body responded beautifully. His circulation improved, his prostate stayed active but calm, and his mind was clearer. Now, there's something else I want to touch on because it affects every man past 60, whether or not he's sexually active: blood flow. As we age, our arteries naturally stiffen, and blood supply to the pelvic region declines. That means the prostate, bladder, and even erectile tissue receive less oxygen and fewer nutrients. Regular, gentle stimulation helps restore that circulation, almost like a workout for your pelvic area. But when that stimulation turns into tension, rushing, or guilt, it cancels the benefit. Stress tightens the pelvic floor muscles, reduces blood flow, and can leave you feeling drained instead of rejuvenated. That's why the mental approach matters as much as the physical one. If you're watching this right now and realizing that stress or shame have affected your habits, go ahead and type yes in the comments below. It might feel small, but your response helps me understand what men like you are truly facing, so I can tailor advice that speaks directly to your needs. And while you're there, please take a moment to like this video and subscribe. It helps us reach more men who quietly struggle with the same questions. Let's go back to Harold for a moment. Once he regained his confidence, something unexpected happened. His energy improved. He told me, "Doc, I used to nap twice a day. Now I feel alert again." That's because the prostate and hormones are closely linked. When the gland is healthy and not under chronic irritation, it helps maintain a smoother hormonal balance. Testosterone levels stay steadier, and stress hormones like cortisol drop. There's even evidence that a healthy prostate supports better sleep. Many of my older patients tell me that after improving their habits, balancing frequency, staying hydrated, and letting go of anxiety, they sleep longer and wake up less often at night. That's not magic. That's biology working properly. Of course, not every man will have the same experience. Some may notice more sensitivity, others less. Some might need longer rest periods, especially if they're on medication that affects blood flow or hormone levels. The point is, every man's prostate has its own rhythm, and finding yours is the key to lasting comfort and function. I remember one patient, a widower in his 80s, who told me with a wink, "Doctor, I'm not looking for fireworks anymore, just a spark." And that spark matters. Maintaining a gentle connection to your body keeps the prostate engaged and the mind youthful. It's not about performance, it's about vitality. When Harold came in for his final checkup, he didn't look like the same man who'd first sat nervously in my office months earlier. He looked lighter, not just in body, but in spirit. "Dr. Easton, I've learned more about my body in the last few months than I did in my whole life." And he wasn't exaggerating. Because when men begin to understand the truth about their prostate and how it reacts to daily habits, they stop living in fear and start living with awareness. That's what I want for every man watching this. Not guilt, not confusion, not the idea that something natural makes you broken, but clarity, confidence, and control. So let's summarize this in the way I explained it to Harold. Daily masturbation by itself isn't harmful. In fact, it can keep the prostate functioning and prevent congestion if done with mindfulness. But when it's forced, rushed, or used as a distraction rather than a moment of connection, that's when irritation can begin. The prostate, like the rest of your body, responds to rhythm, relaxation, and recovery. When you listen to your body, rest when you're sore, drink more water, slow down instead of rushing, your prostate responds with gratitude. It stays calmer, less inflamed, and more balanced. That's the secret men rarely hear. Your habits shape your gland's health far more than your age does. And it's not just physical. Emotional health plays a massive role. Shame and anxiety can tighten the pelvic muscles and increase pressure on the prostate. That's why I tell men to approach self-pleasure the way you would a slow walk in the park. No guilt, no goal, just presence. Let your breathing slow. Let your body lead. When done this way, what once felt mechanical becomes therapeutic. Harold learned that. He told me he no longer used those moments just to get it over with. He saw them as part of caring for his health, his prostate, his blood flow, his peace of mind. And that shift gave him something more valuable than any medication could: ease. Now, I know some men are still skeptical. They think, well, doc, that sounds nice, but I'm already having prostate issues. What good does this do me now? My answer is always this: it's never too late. Even small changes, more rest between sessions, better hydration, light pelvic stretches, or just releasing guilt can make an enormous difference in how your prostate feels and functions. And if you're wondering whether your own habits are helping or harming, start paying attention to your body's signals. If you feel discomfort or fatigue afterward, take a day or two off. If you feel relaxed and energized, that's your green light. Your body is wiser than any theory. It tells you exactly what it needs, if you'll only listen. There's one more thing Harold told me that stayed with me. You know, doc, I used to think my prostate was the problem, but really it was me not understanding it. That's such a powerful truth. The prostate isn't your enemy. It's a part of you doing its best, even through decades of change. With care, it can serve you well for life. And I've seen this time and again. Men in their 70s and 80s who take care of their prostate through balance, awareness, and healthy living often enjoy better urinary control, improved mood, and, yes, a stronger sense of masculinity. It's not about chasing youth, it's about preserving vitality. So if you're still wondering what happens to the prostate of men who masturbate every day, here's the honest answer. It depends on how they do it. Done mindfully, it can help. Done excessively or anxiously, it can harm. The difference lies not in the act, but in the intention. And that brings us full circle to Harold's journey and perhaps to yours. He learned that aging doesn't mean giving up the parts of life that make you feel alive. It just means learning new rhythms, new patience, and new respect for your changing body.